name is Marisha Chilcott. I'm the physician at Morpheus Medical Aesthetics. I'm going to be talking today about Profound. Profound is a non-surgical procedure that results in lower face and neck tightening with about 30% of the effect of a facelift. Profound uses radiofrequency energy to heat the deep skin, the net effect being improvement in collagen production, elastin production, and generalized tightening. The benefits of Profound is greater confidence because you end up with a little bit of a tighter jawline, and yes, I've had not just one but two, and less of that early jowling that can happen to our faces as we age. The best candidate for Profound procedure is someone who has just started to notice that their face is starting to sag or that they have lost elasticity in their neck. It's not a good procedure if you've gotten to the point where really the best treatment would be a facelift. Someone maybe in their mid to late 40s, early 50s, even early 60s if you've got great skin tone, but have just started to feel like, oh, when I look down at FaceTime, when I'm on a Zoom, this part is driving me crazy, or when I look like this and this part drives me crazy. That's a good candidate. The process of having a Profound treatment involves first getting all the way numb. We give you a little bit of medicine because numbing is the worst part. What I mean by that is we give you a little bit of Ativan or Xanax, a little bit of Norco or OxyContin because the discomfort of getting numb is actually what is most uncomfortable. The numbing process then involves having small injections using a cannula from the edge of the eyes down to the base of the neck. That process actually takes about an hour. After that, the process of having the Profound is very relaxed and easy. You feel essentially nothing. The downtime after the Profound is 7 to 10 days of really severe bruising. Typically, there are black and blue under eyes, black and blue mustache, black and blue under the chin, down the neck. How long it actually takes your body to metabolize bruising sort of defines whether you're closer to 7 days or closer to 10 days. Arnica can help resolve that more quickly, and taking things like bromelain, which we suggest, also help improve that more quickly. That said, I generally recommend that you're in a situation where you don't need to be outside and in public much for that first week at least. In spite of looking terrible, you actually feel fine. So unlike lots of laser procedures where there's a lot of pain and discomfort afterwards, there's almost no pain at all. It's just that you look really beat up. The Profound is generally a single treatment procedure, although I have had patients want to do it twice because they got incremental improvement and then wanted that same increment further, and then they did get it. Typically though, you just do it once and then you get to see the results. Several years later, you may want a second treatment. I had my first treatment in 2014 and my second treatment in 2019. You see results really at 6 months. That said, in our office, we take after pictures at 5 weeks because you can already see the changes at 5 weeks, and what I like people to do is see their before and after pictures with no other procedures complicating the impression. And the reality is, after 4 or 5 months, we're gonna want Botox again, and we're gonna want to get some other kinds of fillers, potentially. So I want you to just see the treatment results after 5 weeks. As the company describes it, and as I have experienced it, the beauty of that is you see some results and then you get to see things get better and better for another several months. And the main thing you need to do is to prevent yourself from getting sunburn. Your skin has been penetrated by what are called microneedles, although I call them macroneedles. And I say that because the needles are anywhere between 4 and 7 millimeters long, depending on whether we're doing a treatment for straight skin tightening or in addressing a little bit of extra adipose tissue in the jowls or under the chin. Immediately after the treatment, you will be coated with your own PRP. PRP is platelet-rich plasma. At the beginning of the treatment, we do take a little bit of blood out of your arm and then spin it down with a centrifuge, then use that platelet-rich serum to help seal and heal the wounds that are incurred because of the Profound itself. We do also coat you with some antibiotic ointment, and then your job when you go home in terms of aftercare is just to keep your skin nicely moisturized. We do send you home with a couple of products and direct instructions on how to use those, and then your other job is, of course, to avoid getting sunburn or having direct sun exposure. But that's kind of the key for everything. There's nothing really special about Profound in the terms of things that you cannot do, and there's nothing extremely special about things that you must do. Just keep yourself moisturized. So once again, I'm Dr. Chilcott. I look forward to seeing you in the office, talking more about Profound. Anyone who wants it should have a full consultation to confirm that you're an appropriate candidate and that you will get the result that you're looking for.